If you're over 60 and dealing with knee pain, there's a good chance you're doing the exact thing that's making it worse. It's not your age, it's how you're going about trying to fix it. And in this video, I'm going to show you what's actually causing your knee pain and the one thing I have all of my patients do that actually works. Here's what I see all the time. People think my knees are wearing out. I'm getting older, I'm struggling with getting up and down, so my knees are just wore out. I've had a long life. So I'm just gonna slow down, I'm gonna avoid movement, I'm gonna, make sure I take care of what I've got. I'm trying to protect my knee. That's what I'm trying to do. I see it all the time. But the thing that I want you to think about and the reframe, maybe the question I want you to have about all of this is, why are you doing this? Or what is the point of this? I want to say at the front end that it's not just about the knee. It's not just about your joint. You've lost the strength and the control in the positions that your knee actually needs. And it's not just your knee that's giving you the trouble. It's your ability to control your body that is actually going down with what's going on in your body right now. Where most people go wrong. They think, okay, well, maybe I'll do some stretching, or maybe my knee's hurting, so I need to rest a little bit. Or really, like, it hurts to go upstairs, it hurts to go downstairs, hurts to get up, so I'm just gonna avoid doing those things. That might feel better in the short term, but it never fixes the problem in the long term. The thing is that if you don't actually put your knee through the positions that are gonna help it and make it better, then it doesn't get any stronger. If you don't load your knee, it doesn't get any stronger. So stairs are still gonna be a problem for you. Getting up out of the chair, getting up off the toilet is gonna still be almost difficult to do, or eventually get to the point where it's too difficult to do. I'm reminded about this one patient that I had that came in to see me at the clinic, and she was having some knee pain. It was getting harder for her to get up and down out of the chair. Biggest thing that she struggled with was actually getting up and down stairs. She wanted to be able to go up to her second floor in case she needed to, because there were some things up there that she needed to get to. And she was doing all of the right things, taking the rest, doing a couple of knee stretches or just some simple exercises that she had gotten from PT in the past. But what we found was the main thing that she really struggled with was the lack of strength and the lack of control that she had over her legs, over her knee, to be able to do all of these things. Once we started working with this, once we actually started training it and actually started pushing the limits of what her body was actually able to do, things started to change. Okay, so what actually works then? We need to be able to train the knee in real life positions, not avoid them. And this is where typical PT advice, typical advice from most physical therapists, is actually going to do more harm than good in a lot of ways. Typically, most of the things is slow down, watch out, be careful, do these exercises, these simple chair exercises, but they don't actually do anything for you in real life. So this is where an exercise that you've probably been avoiding is actually going to help you out in the long term. So the exercise that you've been avoiding that is actually going to help you is going to be the squat. Yes, I know what you're thinking. You're probably thinking, I haven't bent down and squatted in years, but there are ways that we can work this, starting from the low end, working up all the way to the high end. What the squat actually does is that it actually builds the strength that your knee actually needs, and it actually it's the thing that it's missing. So what's great about it is that it goes through the entire range of motion of what your knee is able to do. At its foundation, the squat is just bending down while bending your knees and your hips and then standing back up. Think about the easiest way to think about this is like coming up from a seated position in your chair to standing up all the way. The reason why this exercise works is, again, it works through all of the ranges of motion that your knee is able to do, and it works on the muscle of your thigh. We call that the quadriceps muscle. It helps you to be able to use that muscle along with the other muscles in the back, like your glutes, your hamstrings, to help you to stand up and support the knee as you come up from a seated position or from in the lower position into a fully upright standing position. And this translates over into multiple different areas, not just being able to get up out of a chair, being able to get up off the toilet, but also it translates to if anything were to happen, if you were to fall, you have the strength to be able to get from on the floor back up either into a chair or up to a standing position all the way. And it also translates over into going up and down stairs, doing one step at a time, or doing one leg on one step at a time, as opposed to the stepping up onto both feet onto the step like I see so many people doing. The thing I want you to think about if you start off with this exercise, no matter which way that you start off with, is that you want to think about control. Speed is not the play right here. We'll get to that eventually, but right now keep things nice, slow, and controlled, because that slower pace is going to help strengthen the muscle without having to add a lot of weight to the exercise. You want to use your full body weight while you're doing this as well. You don't want to try to hold on to anything if you can help it. And there's tools and tricks that we can use to help us use your body weight in a way that's going to be perfect for where you currently are right now. So this is how we start off with this. If you start thinking to yourself, there's no way that I could just stand in the middle of my floor of my living room and do a body weight squat, go down and stand back up, then we want to start off with standing up out of a chair. So grab you a chair, sit down in it, cross your arms, see if you can stand up. One thing that you're going to notice is either you're going to try to come straight up, or if you have to rock a few times in order to get stood up. If that's a problem for you, if you notice that you do either of those things, what you want to do is you want to try to lift yourself up. So either get up in a higher chair. I have some people start off with this, like sometimes in a bar stool if their feet can touch the ground. If they don't have a bar stool, then what I typically have them do is take a few pillows, maybe take a few books or something, and put that in the chair of what you're sitting in, so that it keeps you from being in this position. Let's say this is your thigh, these are your legs, so this is your knee joint right here. So it keeps you from being in this position, and it puts you more like into this position. So being able to adjust where your legs are, the angle that your knee is at, whenever you start the exercise will help you to be able to start where you can comfortably to build the strength in that range first. And then as you get stronger in that range, then we can start lowering it down to get back to a normal seat level, which is about 16 or 17 inches. The sit to stand from a chair is the easiest version. Again, if you've got to adjust it, put the whatever you need to in your chair in order to raise you up a little bit, but you're going to start working your way down to the point where you are at the normal seat height. After that, then we can start loading it. So take you some weight, anything that you've got around the house. If you happen to have any dumbbells, kettlebells, anything like that, start off with your lowest weight and go from sitting to standing up with that without using your hands. Once you get pretty good at being able to do a sit to stand with weight, you can start to mess around with being able to do a full body weight squat at that point. I would caution, if you're going to do that, go ahead and get somewhere that you can easily hold on to something if you need to, and only go as far down as you feel comfortable and confident with. The biggest thing that I see, the biggest issue that I see in people trying to do a body weight squat, especially for older adults, is that they tend to want to just go straight down and come back up, bending both the knee and the ankle at the same time, or they're trying to compensate in some way. And so one thing that you can do to help avoid that is think about that you are pushing your hips back. You're pushing your butt back to the wall behind you, or whatever it is that's behind you. And that's how you squat down first. Keep your feet flat on the ground. If it's hard for you to keep your feet flat on the ground, it's okay to take something like a book or a small book, something like that, to put on the ground that you can put your heels up on, and that's going to help take out some of the ankle mobility issues that you may have, so that you're able to actually go down and come back up. The reason why you might want to do this near your kitchen sink or the kitchen counter is in case you need to hold on to something, just to kind of help steady yourself as you get used to this motion. But try not to push through the counter or try to push through the sink as you do it. You really want to focus in. The main reason why we're doing this exercise is to strengthen up the legs. So pulling or pushing as hard as you can through your arms is not really helping you in this case. It's actually making it harder for you in the long term because you're compensating through your upper body as opposed to using your lower body to really strengthen. So it's there to be as a guide, it's there to be as a safety net in case of anything. If you're really concerned about it, get a chair to put behind you. As you come down and you feel your bottom touch the chair, you stand straight back up. What that's going to do is that it's just going to be that cue in your mind that once you feel your bottom barely touch the chair, instead of sitting all the way down and then coming right back up, you're able to keep yourself under that tension and then stand back up, and that's going to really drive up some strength gains for you, more than you could even imagine at your age. Eventually, if you get really good at this, then we start adding some weight. Holding on to a dumbbell, holding on to a kettlebell in front of you as you go from the upright position to a squatted position and back up. But that is not something that you start off with. That's something that you build up toward. And it may be beneficial for you to have some assistance and some coaching, extra coaching with that as well. So then that'd be something where somebody like me, like a physical therapist or a trainer of some kind, would be able to help you to get to that point, or to at least give you that safety, that feeling of I'm not going to hurt myself because I know somebody who is confident and qualified to do this is able to help me out. Remember what I said earlier, if you don't use it, you lose it. If you're not training for these real life positions, you're going to lose the ability to do these when the time comes for it. And ultimately, this is how you stay independent. It's not just pain-free at this point, it's being able to do all the things that you care about, whether that's traveling, whether that is living at home independently, whether that's being able to carry in your groceries, being able to keep up with your grandkids. It's all about that, not just about keeping the pain away. If you found this video helpful, I'd appreciate a subscribe. If there's somebody in your life that you know that needs to hear this, go ahead and send it to them. You can click the link down below on the share and send it to somebody that needs some help, that has some knee pain. If you have your own knee pain or other troubles that you have about, please put them down in the comments below. I will read them, and that might help me to get an idea of what kind of videos to make next. And again, if you liked it, you can like this video, and I have some other videos that you can check out as well over here. I think if you appreciated this episode or this video right here, I've got a video right over here that you might find helpful and useful as well. Thank you guys so much for watching, and I will see you guys in the next one. Bye, everybody.